person.
It's wonderful to see you too.
I love that you're here. This is an important month. I mean, I feel like that's so much of what we've talked about on the show during the pandemic the last few months is how tough it's been for our children, but also for us as adults.
Yes, and you know, the good news about Mental Health Awareness Month is it's top of mind. So we're talking about it more, we're hearing about it more. Sadly, we've seen so many deaths by suicide in the media, and it does bring an awareness. And I think the most important thing is that we start talking about it and destigmatizing it and normalizing that everybody is kind of struggling right now.
You see patients every day. I'm wondering, is there anything that you're hearing from people now that you didn't hear 3 years ago, 5 years ago, 10 years ago, that really it's like hitting you, that things have changed?
Well, two things. I think more social anxiety than ever because we've been isolated for so long. So this idea of how do we connect with people, what do we talk about, maybe feeling more self-conscious, and then also alcohol. People have been increasingly drinking more to manage symptoms of depression and anxiety, and people feeling bored and being at home more. And so more than any other year have I noticed that there has been an increase in substance abuse.
Let's talk about that a little bit because I wanted to mention your movie, Gray Area. This was adapted from your book, which you've shared with us before on the show, as well as your own struggle with alcohol. So what do you share as somebody who can truly understand this perspective as it relates to abusing substances?
Sure. So I think oftentimes we look at somebody having a problem. Even when I interview my clients or do a diagnostic, they'll say, oh, well, I don't drink in the morning, so I don't have a problem. And really, it's about a whole health perspective. And with the adaptation of the book into a movie, we're really using it as a tool to teach people and educate. My husband is an actor and plays my husband. I'm not in the movie.
Okay, but that was him that we saw on screen.
Yeah.
That's fantastic.
Yeah, and we have 4 kids, and you know, this overachieving sense that I felt that on the outside, nobody knew that I was struggling and having panic attacks and just trying to keep my head above water. And so that's what's really important, especially as we hear about these college athletes who are just having so much pressure placed on them that maybe they place on themselves too. But oftentimes we think of depression as, oh, our kids are isolating in their room and they're not participating in anything. Absolutely, that happens. But I think there's a saying that we also have to check on the strong ones.
Yeah, absolutely. And those athletes that you mentioned are people who appear to be the absolute strongest, and they're so goal-oriented sometimes. The pressure you mentioned, I think, is real. So what can we do then to take better care of our mental health selves for us as well as our kids?
Well, just as you and Tiffany were speaking about how we look at things, I'm a cognitive behavioral therapist, and so a lot of times it's, what are we saying to ourselves? What is the dialogue? Are we putting ourselves down? Do we have a negative worldview? So being able to recognize when we do that and shift the thinking. And we can oftentimes practice that with our own kids. You know, I have a 10-year-old, if she's on her way to school and she's like, oh, it's such a long week and I'm dreading this and dreading that. And it's like, let's focus on just right now, that being present and being mindful. What can I manage today? What can I manage in this hour? So if we break it down into more simplistic ways of thinking, it just feels better. Yeah.
Do you feel, because this is something that I think some of us have to practice if you're not naturally optimistic. Can you change? You know, we talked about people being cynical and people being negative and not feeling hopeful. Can you become a hopeful person? Can you actually improve your mental health by changing your thoughts?
Thank you for saying that, because oftentimes I hear people say, you know, they come into therapy at 82 and they've never been in therapy before, and they said, oh, you couldn't possibly help me change. And I said, I'm in the change business. Absolutely. The hope of it is, you know, some people are born into the world a certain way, maybe more optimistic, glass half full, glass half empty, but it really is about how we look at things and how we change our patterns. And so it might not be a natural reaction. I mean, even when you guys were talking about, you know, some things that are good for health, I heard, oh, a little bit of wine. And for a moment I thought, oh, that sounds good. I haven't had wine in 9 years. Maybe I'll have a sip of wine. It's good for your health. And then I thought, stop. That's not a helpful thought.
Right. But I like that kind of stop and then change it to something that's more helpful. Because I think with kids, you mentioned your daughter, when we have kids who struggle with anxiety, who dread things, it's painful as a parent, and you want to help them change their thoughts.
And we have to model that because they are sponges and they are looking to us to set the tone for that. And so it is like going to the gym. You know, we don't just get to a place where we feel like we're in the best shape of our life and we never have to work out again. It is a daily practice. So get up and make that gratitude list, write down your negative thoughts, purge on the paper, talk to somebody. And it's really important to seek professional help if you feel like you can't get out of this rut. And if you're really struggling with internal thoughts and feelings of wanting to hurt yourself, absolutely reach out to a professional.
I'm glad you just mentioned that, because we're going to share the hotline for the National Suicide Prevention Services. Thank you so much for being here today. It's such important stuff for us to change.